started off very rough because my first posting was ONG in Hospital Sultan Aminah, Johor Bahru. ONG was the most malignant posting in that hospital, and was extended in ONG. It's just the culture there where they will just blame anyone that they can blame. I really felt like a failure throughout, especially in the beginning, in the first half of Housemanship, right? One day I couldn't take it anymore. I just decided I just want to quit. Texted the specialist in charge of Housemanship at that time. I told her that I feel like I just want to quit Housemanship now, and probably like today will be my last day, and I just want to resign like with a 24 hours notice.
What's it like in forensics?
There was one case that a baby just like suddenly turned blue in daycare and didn't make it. Those were the cases that affected me the most, having to autopsy the babies. I didn't have a job when I left, and yes, it was scary. Some medical doctors coming into Pharma as MSLs, and they have to leave within a few months because it was something that they couldn't overcome.
Join Disruptive Doctors.
I'm Dr. Selina, your host and co-founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. In Postcall, we dive into the untold stories of doctors who are breaking the mold, trailblazers who are redefining what it means to be a doctor. This is Postcall Beyond the White Coat. Hey, welcome to another episode of Postcall Beyond the White Coat. Today, I have with us our guest, Dr. Nadira Azmi, who's currently the Medical Therapy Area Lead of AstraZeneca. We'll be exploring how she journeyed from being a medical doctor in KKM to transitioning into the pharmaceutical industry. Hi, Dr. Nadira.
Hello. Hi, Selina. Thank you so much for having me.
Hi, thank you for coming to share your story. I was just wondering, what was it that made you decide to go into medicine in the first place?
Well, to be honest, it wasn't really a decision that I made. Purely by myself, because during that time, which is like way back in, I guess, I was Form 5 in 2005, right? I took SPM in 2005. At that time, the only three ambitions that a kid will have is doctor, lawyer, or engineer. You don't hear any other besides the three. So I did well in school. So naturally, I went into the science stream and everything. So then I went into matriculation and everything and all that. And I did well in matriculation also. So naturally, medicine was the way to go. Not to say that I was interested to be a doctor at that time, but I didn't really felt that I had any other choice since I did so well in school. So that's why I applied for medicine. And I went to medical school. Once in medical school, though, of course, you don't think about like quitting halfway or what. Once you're in there, then you just need to finish it off, right? So that's naturally what happened. Not to say that when I was young or what, my ambition was to become a doctor and everything and all that. That wasn't the case.
Okay, then when you finally graduated and you got into housemanship, what was it like? Because it wasn't your ambition, it was just go with the flow. So what was the experience like?
So my housemanship, I have to say, it was a very bittersweet experience. So during my time, the housemanship was 2 years, compulsory 2 years of housemanship. So it wasn't the contract basis yet at that time. It started off very rough because my first posting was ONG in Hospital Sultan Aminah, Johor Bahru. I don't know if any of my ex-colleagues are listening in right now, but I think we can all agree that ONG was the most malignant posting in that hospital in HSA. So as a first poster, going straight away into ONG was really, really stressful. At that point of time, I was already thinking of I wanted to quit. I couldn't continue with this. And it was just like a couple of months or a few months into the ONG posting. So each posting is 4 months, right? So that was very tough for me. But I have to say that when you go through tough situations with other people who are in the same boat as you, so there were like other housemates, my batch and my peers and everything, and we were all facing the same situation, right? We bonded really, really well. So I have to say that that's why I call it a bittersweet moment. I have like the worst memories during my housemanship, but also the best memories also. And until now, um, even though we don't keep in touch naturally, we don't like contact each other every day or what. And because everyone is like everywhere right now, there's like they're going to different specialties. Some are already specialists and everything. But when we reunite again, for because I'm still in I'm in pharma, right? So then I have to also meet with a lot of different specialists and everything. And so some of my housemanship peers, they are already specialists who are actually the HCPs that I need to meet. And so that's how we reunite. And when we reunite, it's as if like we never even lost contact throughout those many years. So I feel that once we bonded during that housemanship, the bond actually stays until because we went through the same situation, the same hardships and everything. So I was really thankful that we had that. So definitely I had my worst memories, like really, really bad memories, getting scolded, all the stress, having to go to work like at 5 a.m. I already had to go to work and start clicking patients and everything, and then going back home like midnight, and then the next day start all over again. And some more because my family's in KL, so I was in JB. So I didn't really have anyone, as in my family. So really dependent on the friends that I have there. So yeah, so the worst memories, but the best memories because we had developed really great, amazing friendship during that time.
Was there any particular incident that you would consider one of your worst memories there?
Uh, Particular incident. Well, there are several. So there is one incident in ONG posting where there was one patient. I remember she had sickle cell anemia. So if I remember correctly, I was the one that had first came in contact with that patient. So I did the necessary things, clerking and everything. And she was already flagged a patient, an urgent patient and everything. So she was actually in the high dependency ward for the ONG patients already. But she didn't make it. And really unfortunate. It was really unfortunate that she couldn't make it. Again, looking back now, there was nothing that was my fault or anything because I was the houseman, did the clerking and everything, and the specialist also was there and everything, so it was fine. But it's just I think it was just the culture there where they will just blame anyone that they can blame, especially the juniors one and everything. So I felt that they didn't directly blame me, but in a way, how they um how they mention about it, about the patient and about me, the one hugging the patient and everything, it felt like it was my fault. About looking back, because when you're in that situation, everything that goes wrong, you think that it's your fault, especially when you're already like really, really down at that time, right? And you're thinking that you're a horrible doctor and everything. But that wasn't the case. It was just the culture there that is like a bit hard to explain unless you're in that situation. But yeah, I think that was one moment that really like stuck to me because I think that was like one of the first patients that actually had passed away under my watch. So it was like really hard for me, and especially hearing the specialist and everything saying stuff that felt that it was my fault. So yeah, so that was like one of the things. I know we hear always all the time about like bullying in during housemanship and everything. And there's some extreme. There's some, I would call this not really bullying. It's not like the extreme one, but it sticks to you, especially when you're really down in the dumps like that. It really does stick to you. So yeah. So but looking back, it was something that I know that it definitely was not my fault. And then having after that, seeing more and more patients and more cases, these things will happen. So yeah, so it's just that when it happens, I guess you have to understand also the perspective of other people, especially the junior ones, that they might blame themselves on it. So don't pile up that blame on them. So yeah, that's what I learned throughout.
how did you overcome that and realize that it happens on the job and it's about how you manage what you feel? And did you feel like a failure throughout your housemanship?
Oh, definitely. That is no question. I really felt like a failure throughout, especially in the beginning, in the first half of housemanship, right? Uh, it was, and I think it was like a mutual feeling also, not just me, but with the other housemates also. w- We do will feel like failures, because we're not really prepared. I would say, like after medical school, you're not really prepared of what you're going to face during housemanship, um, like in the real life situation, right? So, but how we got through that was one, of course, having friends. That's why I mentioned that, oh, having friends is like the most important thing, having that bond between people. You cannot really um, pile up those feelings by yourself and not really like tell anyone about it, because when you keep it to yourself, then that's definitely when that's when I think those people will go into depression and everything, because you don't know, you don't realize that other people are in the same boat as you. So definitely having friends and people to talk to was something that I really, really needed to go through my housemanship. Halfway through my housemanship, I met my future husband, so that really helped a lot, especially because in JB I didn't have a family and everything, right? So after meeting my future husband there, also I had someone to confide in, and because my husband also, he is a medical doctor as well, so he completely understand also what I was going through and everything, and I think that really pushed me to complete my housemanship also. So having people around and having people to talk to, you realize that everyone is feeling the same way. It's just whether or not they are talking about it or not. So yeah, so that one really got me through my housemanship.
Think you're so spot on that, because during housemanship, um, it was it was a process of learning. Yes, it was difficult. You get scolded, you get blamed, and you always put in the spotlight when something goes wrong. The spotlight is shown on you. Who is the last person or first person or the only person who has seen this patient? And and it's not a nice feeling. But after that, I also realized like what really helped me through my housemanship was having a very good housemate. I was also like you. I was in Seremban. I had no friends. I have no family. I was alone there, and I had to learn to make friends. And all these friends that you bond with during housemanship, they really helped me through, because you can get together and just vent out what you're feeling. And I think we doctors have a dark humor, how we laugh things off and how we talk about it and make it funny, that when the same situation happens again, it's no longer stressful or demeaning. It just becomes funny because you realize, oh, your friend actually spoke about this and talked about this, and now you're going through it.
Yeah, yeah,
Yeah. So,
exactly.
like, what made you decide to? Okay, before that, like, do you feel that people looked at you differently because you never really had this, like, I want to be a doctor drive? You just went with the flow and you ended up being a doctor. Do you think you were looked at differently by your peers or the specialists?
I think with my peers and specialists, not much, because I didn't really enclose to them like, oh, this is not what I ever what I wanted to do. Uh, I'm just going with the flow. That's why I've never really enclosed with them regarding that. But but there were times, so actually there's one situation when I was a houseman. I really hardly talk about this, but I guess for the benefit of the audience, right? So there was one time, it was my second posting. So my second posting was medical, after ONG. And I think it was just like barely a month into medical, but because I was 4 months in ONG and then I was extended 1 month in ONG. And in ONG, I was already like feeling very down and everything. I already wanted to quit, but I just completed 5 months of ONG and then I went into medical. When I went into medical, I already had this feeling like I didn't want to continue anymore. Like, how much more can I take? Just 5 months of ONG was already like really suffering for me. imagine like going through the other postings. So I better quit while it's still early. So going into medical, like even less than it was less than barely a month. Um, One day I couldn't take it anymore. I just decided I just want to quit. So what happened was that that day I went to work like usual. And then by right that time my shift finished at 5 p.m. But I was still like taking patients' blood and everything. So it was like 7 p.m. I was still in the ward doing work, like finishing off all the work and everything. And then I just a whim, I decided I just want to quit. So what I did was I texted the specialist in charge of housemanship at that time. I told her that I feel like I just want to quit housemanship now, and probably like today will be my last day, and I just want to resign like with a 24 hours notice. Um, so and after that, I shut down my phone because I didn't want her to contact me or like try to change my mind or what. So then but I'm so grateful because she was the kind of specialist that like really cared about her houseman. So what happened was when she couldn't contact me, and this was like already 7 p.m., 8 p.m. at night, she was already at home. She knew I was working at that moment in the ward. She actually told the specialist, the medical specialist on call that day about what happened and asked him to look for me in the ward. So he actually came and looked for me. And he told me like, okay, he knows what happened and everything. So he like took me aside and then he started talking to me and stuff like that. And he gave me like really words of encouragement, saying that I was not a bad doctor and everything. Why do I want to quit and everything and all that? And he had faith in me that I could go and I can go beyond this. I can finish off housemanship and everything and all that. And during that time he was talking to me and everything, the specialist that was in charge of housemanship, she actually came to the ward from home. And she came and looked for me. And then she was like, come, let's go for dinner. You can just leave whatever work you have left, just leave it to the houseman in charge of the next shift. Let's go for dinner. So she took me out for dinner. Then we had like a very good conversation and everything. And then she asked me to take a few days off. She told me that she already told the houseman in charge of our roster that I'm taking a few days off. And so she told me, why don't you just go back to KL, go back to your family and just rest for a few days and come back fresh. And so I did. So I didn't get to, I didn't manage to quit at that time. So I'm sorry, what was your question again?
No, that was a very good sharing, as in I think what younger or junior doctors actually really need is someone to believe in them, or superiors that, knowing that you have a superior that has your back. I think that actually is what is missing. Because when I'm thinking back of the time when I made a decision I was going to quit and leave medicine, it was because I felt all alone. I didn't have anyone who had my back. I was injured. I was trying to recuperate, and the entire department was against me. That was what I felt, and that really just pushed me off the ledge and made me decide I'm not doing this anymore.
Yeah, yeah, exactly. If let's say those two specialists till this day, and I still remember who they are, and in fact, the specialist on call, I'm sorry, the specialist that came to search for me in the ward and everything, I'm still in contact with her like until now. If they weren't there for me at that time, I definitely would have just quit. I wouldn't have finished off my housemanship and everything. Probably I wouldn't even be in pharma. I don't know what I would be doing. But yes, but without them, definitely I wouldn't have been able to continue, because having, like what you said, having a superior give you that words of encouragement, that's what you need to hear. Because you don't believe in yourself at that time, even though you're not a bad person, you're not doing a bad job actually, but you just feel that you're not doing well. But having like a superior tell you that, you know, just keep on going, you can do it, I know you can, I trust you and everything, that really pushed me to just finish off and complete my housemanship. So I'm really, I'm really grateful that they were there for me.
I can see that there's two very different scenario, and because you were in ONG for 4 months and you got extended. I mean, that's practically every houseman's nightmare to get to get a pink letter and get extended. How did you deal with that when you know because you were very new, you were a brand new doctor, and you were given that pink slip that you are extended? It basically means you're not good enough. How did you deal with that?
I don't even know if I really dealt with it. I felt like I was kind of like a zombie. I didn't really have any feelings or anything. I just knew going to work as a housemanship at that time, and because I was living alone, also I wasn't living with any families or what. Um, it was just like an automatic thing, right? Like just to wake up, go to work, do the work, then come back. Really, really, like I had no feelings at all. I was really distant with a lot of my friends also. With my family members also, I was like they would like just text me and I would just like reply with like a one word and all that. At that time, I really was at my lowest point, I would have to say. I just, I try to block that memory also. I don't really talk about it much as well. Actually, this is the most that I've really talked about it since then. But yeah, but it was really tough, especially after being extended. And I still remember the reason that I was extended was because I didn't complete my logbook. And the reason I didn't complete my logbook was that because I it wasn't that I didn't do the procedures. I just didn't care about having like the MOs or specialists to sign off my logbook and everything because I just didn't care anymore. Because at that time I just didn't care. I just want to quit. Whatever. It was like I really had no feelings at all. Um, so that 1 month I was extended in ONG also. Yeah, it was very difficult. I just went through it. At that time, I think I didn't really have anyone having my back because I didn't really talk to anyone. So at that time, that's when I really just shut down. I didn't want to talk about what I was going through. I didn't want to talk to my friends about it because imagine like my friends who are in the same batch, right? They were already moving on to the next posting and I was like stuck there. So I didn't, yeah, if I could, I didn't want to have any contact with them or anything. So I just went with it until I reached the medical posting. So that's when I was like, my second posting, I was like, okay, that's enough. I just want to quit. I guess I reached my breaking point at that time. And that's when those two specialists like really came and helped me out and helped me through it. Yeah. So earlier on in my housemanship, I really practically was a zombie. I lost weight. I wasn't eating. It was really that those first 6 months actually was really, really tough for me.
I think that's what a lot of us don't realize that the housemans or junior doctors or doctors are actually humans. And because I keep hearing this, you should just toughen up, you should just push through. But everyone has everyone's breaking point is different. Everyone has their ups and lows, and some people require different kind of help. You cannot assume that everyone um we can't assume that everyone can just barge through and block off their entire emotions and get through. But sometimes
Sorry.
all we need is it's okay. Sometimes all we need is just that little pat on the back to say, good job, keep going.
Yes, yes, definitely. That was something that was missing in the first year of my housemanship. Without that, right, I don't think that you're able, I mean, like what you said, we're all humans, right? We cannot, if we ourselves sees us, look at us as if someone that's a failure and everything, without anyone besides us telling us that you're not a failure, you can get through this. And especially someone who is also in the medical line also. Of course, my family members kept on telling me that, oh, just go through with it. You can do it. We know you can do it. But then you will always think like, they're not in this line. They don't understand. What do they know, right? So having someone in the medical line who's going through the same thing as you also, or who is your superior to say those things to you, that definitely helped a lot.
Okay, and Did you ever thought that, okay, maybe I might specialize, or did you know from a very early on that you were not going to specialize?
Oh, I knew from very earlier on I would not specialize. That was so the things for about me, right? I don't know what I want, but I am really sure of what I don't want. And definitely I didn't want to specialize. Um, to be honest, even when I was in medical school, I was already questioning myself whether do I want to specialize in something or not. But when you finish off medical school, you don't know what else you're going to be besides a doctor. That's like the only path you have. That's the only option that you have. I just knew that, I'm not going to like continue on having to study another 3 to 4 years, having to go through exams and everything. I knew that I wasn't going to specialize in anything. So that's why I didn't even bother seeing where I was interested in and all. What would happen to me after housemanship? To be honest, I didn't really give it much thought. I just knew that I wanted to do something that's non-clinical. And that's why after housemanship, actually, I had requested to have a non-clinical posting, and that's where I went in. I got into forensics. So I was actually in forensics for 1 year. Uh, but yeah, but I definitely knew that I was not going to specialize in anything.
What was it like in forensics? I mean, not everyone gets to go into those kind of departments. So what was it like working in forensics? Is it like what you see in the movies?
It's interesting, but not as exciting as the movies. Um, in JB itself, it was very interesting because there's a lot of murder cases in JB. There's a lot of gangster groups and everything. So I had to assist my boss, the HOD that time, on a lot of murder cases. So that was an eye opener. That was an experience that not everyone could experience, right? Um, but yeah, I was 1 year in forensics. It's not as exciting as the movie. So it's just like every day, you're doing postmortem on mainly the cases were mainly a lot of accident cases, where postmortem is required. Um, you get to experience a lot of things. I'm not the kind who is really like queasy seeing like dead bodies and everything and having to do the autopsy on them and all that. And it was like a very normal thing to have to do an autopsy, and half an hour after that you're eating lunch like in the mortuary itself. So my HOD that time, he liked to throw like a lot of KFC parties. So he will like order KFC for the whole department, and we'll be eating like at one section where it's like the lobby of the mortuary, where next door is where all the bodies are kept. And so it was very natural actually. It was a very normal thing. Um so yeah, it was interesting. I even had to sometimes go to like crime scenes, where the police requires the medical examiner to come and just examine the crime scene and everything. So I actually did go for a few times, which is very interesting. But again, it was because I was 1 year there. Again, I didn't think of specializing in it. I think my HOD thought that I would because I stayed 1 year there. I think he was hoping that I would continue on to specialize in it. But I didn't have any interest in it, and I was just thinking that I don't want to do this for the rest of my life. Keep on seeing these dead bodies and everything and all that. So yeah, so after a year, because that was still in JB. And again, because my family is in KL, right? I don't have any family in JB. So after a year in forensics, I decided to request to come back to KL. So after getting my request accepted, I was then given a posting in HKL. When I was in HKL, I did request for a non-clinical posting, including forensics, since I was 1 year in forensics. So imagine that 1 year I wasn't facing any clinical cases. I was doing locum on and off, but still locum wasn't the same as like working in the wards and seeing patients in the wards and everything, right? So unfortunately in HKL, the forensic department that time was very full. There was no vacancy. So I was given the option of ONG or medical. ONG was definitely a big no to me. So then that's when I went into medical in HKL. And that was another struggle because after 1 year of not doing any clinical work and then suddenly becoming an MO in medical department in HKL, yeah, that was another big, huge struggle that I had to go through.
Okay, before we get into that struggle, I was just curious when you were in forensic for a year, so you're just dissecting, I mean, doing autopsy, dissecting people, seeing dead bodies, and going to crime scene. Did it affect you psychologically? Did you think like, oh, this person had a life once, and now he's this lifeless thing?
Oh, yes, definitely. Definitely it did. Um, Especially there were some cases where there were babies that had passed away at home or in daycare. There was one case that a baby just like suddenly turned blue in daycare and didn't make it. Those were the cases that affected me the most, having to autopsy the babies. There was one case as young as I think it was 3 months old from daycare. Um, so definitely yes, that one it really affected me. There was one time after I had autopsy the baby also um like usual autopsy and everything once done and everything, then I went into the room to change my clothes and everything. I did cry a bit because and I wasn't even a parent at that time, right? But just seeing that lifeless body there and then having to meet the parents also because we had to go and explain to the parents what we found and everything. Oh, that was a very devastating experience. But definitely it did affect. Yeah.
How did you like what do you guys do to make sure that, because I remember the first death I ever encountered was during my clinical training during my medical school days, and it was a rabies case. So the boy was 16 years old and he was still alive, but as medical professionals, that the moment someone displays any symptom of rabies, it's a 24-hour death sentence. And I had to tell this person, you are going to die in 24 hours. And that affected me so badly for the next almost a month. I couldn't do anything. I didn't know how to go through my clinical training. So how did you manage it?
It was tough. So I really had to tell someone about it. Definitely. So that time I was already with my future husband. So he was my boyfriend at that time, and he was the one person that I had confided into the most. So I really just had to tell him like, look, this is what happened. I want to tell you this one case that I did an autopsy on this very small 3-month-old baby and everything, and I just told him about it. And he also expressed his his sadness about it also. So I think talking about it really did help, and that's what I really had to um uh I think that's how I dealt with most of my struggles, that really finding that one person to talk about. And that's why I was so thankful. And I think that's why me and my husband at the end, I mean, we were in a relationship for 10 years before we actually got married. But I think that's what made our relationship very strong, because I was very open with him with all my struggles whenever I was down and everything, whenever I had something bothering me as heavy as this case. I made sure to talk to him about it. And he also think, because he's also in the medical line, right? So he also has his own stress and everything. So he was also the same. He always talked to me about it every time he's stressed out on something and all that. And I think that really also bonded us and strengthened our relationship. So knowing that I had someone to talk to and someone who won't judge me for it, uh, that was what really made me able to go through all this.
Okay, so after that, you went to HKL. What was it like? Because, like you say, 1 year there's no emergency whatsoever. This is a day body. You do an autopsy, dissect, come up with possible causes and all that. But now you're in medical. There's so many emergencies going on. How did you handle that whole situation, that transition?
I don't think I handled it that well. If I could, I think I would have handled it much better than how I did. Um, yeah, it was tough. It was very tough. It was like a lot of the things that I had to just like refresh myself and remember, okay, this is how it is and everything. It helped a lot that my husband is in medical, that he has been in medical for many, many years. So anything that I was not sure of, I made sure to ask him first before consulting the specialist and everything, or the consultant and all that, just to make sure I don't look so stupid. Um, so it was I really honestly I don't know how I went through it, because at that time also I don't think that I had really many close friends in HKL, because it was a whole new batch. It wasn't like my old friends from Housemanship time and everything, was all new people, right? There was um one guy that I was quite close with. And until now, actually, I still keep in contact with him. He was also new when he came to HKL. Also, was the same time that I came to HKL, so we were both quite new. But he's a very smart guy, and he's actually he's already a physician right now. So but I think he having him also actually really helped me go through it. And yeah, I wish that I could have handled it a bit better. I don't think I did, because I do admit that, like in the beginning, I just said in the beginning, right, that I had like the seniors, specialists, MOs blaming me during ONG time and everything. I admit that I probably did the same also as a MO in HKL, as a medical MO there, scolding the houseman. But again, that came with because of the stress, also like, oh, I expect you to do this. Why you didn't do this yet and everything. Um, that's why I said I wish I had handled it much better, because it's like a vicious cycle. And I at that point of time, I didn't realize that I was doing it. Only after coming out of that situation, that's when you realize, like, oh, okay, you're actually doing the same thing that people did to you last time, and that's why you were so down and everything. Uh, that's when I realized that, I couldn't continue like this and everything. And once I had completed my compulsory service, of MO-ship, that's when I decided, I think I'll just resign. I'll just leave, go to GP or what. But I don't think I can continue this, because I did also ask, like 6 months into the medical, and being in HKL, I did ask the HOD again, and the Pengarah hospital also, whether is it possible for me to change into another, a non-clinical department. But again, they kept on saying that everything is full. Everyone wants to go to non-clinical and everything. The only option that you have right now is still ONG and medical. That's the only one that has vacancies in. So yeah, so even after that, they didn't still want to give me a non-clinical role. So that's when I decided, okay, I finished off my compulsory service. Let me just quit then.
Was it scary leaving KKM? And did you already have a job when you left?
So no. So actually I didn't have a job when I left, and yes, it was scary. I because I didn't have any plan, to be honest. My only backup plan was to do locum first before finding a study job, right? It was scary, and it was really early on also, because like right after I finished that whole 4 years of compulsory service, right, I just quit. So among all my friends that were the same batch, I was one of the very first ones that had quit. And Yeah, it was not a difficult decision to make, because I know that I don't want to stay in KKM. So, but it was difficult in a way that after that I didn't know what I was going to do. So I just quit without having a job. So after that, I did locum first. I did locum like crazy, before I had landed a GP job. So I was given a PIC. I was a PIC in one of the GP clinics. So yeah, it was very scary. Of course, I had to speak to my family about it. I spoke to my at that time my future husband, my boyfriend at that time, about it. I spoke to them extensively about it, of what I wanted to do and everything. They were saying that if you're really sure, then yeah, go ahead. Because my family also couldn't stand to look at me like coming back home, like all stressed and everything every day. So they just trusted me to do what I think what was best for me at that time. So yeah.
Can you describe like what sort of person were you when, I mean, what I meant is, did you recognize yourself like while you were still practicing medicine? Were you like right now you're really chirpy and easygoing and nice to talk to? Were you this person when you were still working in HKL?
Oh, definitely no. Definitely no. I I I was not chirpy at all. I didn't I remember I even had deleted my WhatsApp in my phone. So I had like I deleted everything, like all the messages, like all if I didn't save any numbers and everything, it was all gone. Because I didn't want anyone contacting me. I didn't even want my friends contacting me and everything. I just deleted the whole WhatsApp. I was up until to that point where I didn't want to have any contact with anybody. So yeah, I mean, looking back, I'm even a bit surprised also that I was that person at that time. Like now I really know who I am. I'm so confident in who I am and everything. I cannot even believe that I was actually going through that at that time. If I had to go through that again right now, I don't know how I would be able to go through it. I just, yeah, it was, I was a completely different person. Really, I didn't even recognize myself. Yeah.
When you were in the private GP clinic, what was it like? Like, did you finally found your love for medicine, or it strengthened your belief that non-clinical is the path for me?
So when I was in GP, I was very bored. So it was, especially the GP clinic that I was PIC in, it didn't really have much of a business. The max patient per day that I saw was like 5 or 6 patients, like from 9 a.m. to 5 p.m. Um, so it was a really, really slow clinic. And the cases that kept on coming were all URTI and they just wanted MC and everything. And sometimes the same people kept on coming for MC and everything and all that. So it was I was really bored. But at that time also I was thinking like, I came out from KKM without a job and then I landed this job as a PIC here. I should be thankful that I got a job, right? I shouldn't be complaining about it and everything. But yes, I was super, super bored. So I definitely it didn't like revive my love of medicine. It was I was so that 1 year in that GP clinic, I was looking out also for anything else that I could do besides GP. And yeah, so I definitely it's not something I did not have any plans that I would continue on GP and everything. Because again, if to continue on in GP also the end goal probably would be like to open up my own GP or what, because I couldn't stay as a PIC forever in someone else's GP clinic, right? So, but business was not something that I was like really looking into also. So I knew also that time while I was in GP that this is probably not something that I'm going to stay in forever. But again, I just didn't know what was going to happen after that. So I guess throughout my whole medical career, it was really going with the flow. And when I knew that this is not something I want, this is something that I don't want, then I'll just quit. So you can see that pattern actually. Talking about it now also, I can also see that pattern in me.
Okay, how did you land in pharma? Because, you know, being in a GP, you're really just in that clinic, in that four walls. How did you chance upon pharma?
So I didn't have any idea about like medical affairs in pharma. So even in during the time I was in GP also I had like sales rep coming to me and everything, and that's when I know like okay, yeah, I got the existence of pharma, but the only existence that I knew of were the sales rep. Um so like I said, while I was in GP, I was trying to look out for other jobs also other than GPs, right? But I also didn't know what to look out for because when you have a medical degree, the only thing that you can think of is being a medical doctor. But I did put up my CV in, I think it was Job Street at that time. So I did put up my CV there, and a recruiter found my CV. So the recruiter, she contacted me and she was telling me like, oh, I chanced upon your CV and it seems that you're very qualified to do this MSL, to apply this MSL job. So that was in I forgot which pharma it was. And she told me that, oh, maybe can I try out to go for an interview for this MSL position? I had no idea what MSL was. So that's when I had done my own research on what is an MSL, what does an MSL do and everything. And there wasn't much actually about MSLs at that time. So that was back in, I think, like 2016. But I thought like, okay, this is interesting. It's not GP, it's a non-clinical work. Maybe I just should just try it out. Yeah. So, yep. So I went for the interview. I didn't get it because again, that was like my very first interview into corporate. I didn't know what to expect. I've never been into an interview before. Also, being a medical doctor, you don't really need to have all these interviews and all that, right? So that was a very yeah, I think I didn't do so well in the interview. Also, looking back, but then after that, I decided like, oh, but this MSL thing is quite interesting. Let me search for other pharma that is looking for MSL and apply. So I applied for Novartis MSL, and that's when I got the job. So that's how I came into pharma.
Before we continue, I want to share something very special for our doctors who are listening. If you're a doctor and considering a career shift but don't know where to start, Disruptive Doctors offers a non-clinical Pathfinder workshop. This workshop is designed to help doctors like you explore new opportunities beyond clinical practice and how to choose the right path for you. Whether you're still unsure of whether you should leave medicine or ready to make a change, this workshop is tailored for you. So do check out our annual Disruptive Doctors Conference that happens every August, where like-minded doctors like you come together, share ideas, and impact healthcare differently. Were the interviews hard? Because I've heard of people trying before they manage to get in. But it sounds like after 2 attempts, you managed to get in. What do you think were the qualities you possess that helped you get in there faster?
Yeah, I think I was quite lucky also, in a sense that when I interviewed for the MSL position, right? The hiring manager himself, so usually it's the HR that will contact you and schedule for a meeting and everything, schedule for the interview session and all that. But um, during that time in Novartis, the hiring manager, he was very proactive in finding the right candidates. So it was him himself that called up the candidates where he saw that, oh, from the CV that probably this could be a potential candidate and all that. So he had called me up actually. And the reason that he had called me up, and this one only afterwards, after I got the job, he told me that the reason he called up the candidates is because he wanted to hear how they spoke and how they carried themselves. So when he called me up, because naturally I always speak like this, like very probably not during when I was like housemanship or when I was struggling HK and all that. I didn't spoke as confident as this, but because I was in GP, right, and then I was like bored and everything. I wasn't like depressed or struggling or anything in GP. I was just bored. So I was okay at that time. I was in a stage where I was okay at that time actually. So when he called me up and he just asked like, oh, hi, this is Nadira. Is this Nadira? You applied for this position and everything. May I know like, what are you doing right now and stuff like that? Like, what are you working as right now and everything? So then I just like spoke to him and everything. And then he said, because of that, because how I carried myself and how I spoke and everything, like with much confidence and everything, that's where he felt that, okay, yeah, this is a potential candidate. Let's call her in for interview. So that was one of the qualities that definitely as an MSL, and right now also I'm interviewing for MSLs to in AZ as well. That's one of the quality that we look for: someone that can carry themselves very confidently, can speak very well, and going into the interview. So each MSL interview, we're always given a clinical paper, and Novartis was really hardcore in a sense that they will give you the paper in 24 hours and 24 hours before your interview, and you are supposed to analyze the paper and make a presentation of it and present it during the interview. Not all pharma companies do that, but Novartis does that within 24 hours only. And that was like really stressed out for me because again, I never really, I mean, as a medical student, you don't really like analyze clinical papers and everything. And definitely when you're working as a medical doctor in clinical settings, you don't analyze clinical papers and all that, like with all the statistics and everything, right? So I tried my best lah. It wasn't my best presentation, I admit. So I think the um the reason that Novartis had hired me, not because of my analytical skills or statistics knowledge or what, but it was more of how I carried myself. And one of the questions that they asked is, what is your weakness? And so I was very transparent in admitting my weakness is that I am not used to analyzing a clinical paper. Being a medical doctor and everything, this is not our everyday job, but definitely is something that I can learn, and I am open to learning, and I'm a fast learner. And so if I was just given the time and the right training to do it, I am able to do it. So yeah, so it really right now, because I am interviewing a lot of MSLs, right? The things that stand out between each candidates, and because there's a lot of medical doctors that apply as MSL, and their CVs are more or less the same. When you see the CV, their experience and everything are more or less the same. But what really stands out is how they carry themselves and how they do presentation. As in their statistics knowledge and everything, of course, I don't expect them to be the experts in it, because I wasn't when I was first interviewing for MSL in Novartis. But it's really how they really talk to you and carry themselves and everything. So if I see someone who is not confident, very soft-spoken, when I ask them questions, they're like, "Oh, I'm not sure. I don't know." Like very like unsure of themselves. Then that's when it's kind of like, okay, maybe there's a better candidate than you.
Well, it sounds like because I when you mentioned about presentation skills, I thought of those CME times when we had to present, and the presentation will be so terrible because all you do is read a slide. You would put up the case and then you go straight, okay, the etiology, and then there'll be 10 bullet points, and then the pathophysiology, 10 bullet points, and everything is just bullet points, and you just read off the slides.
Yeah, that's definitely a turn off for me when you're interviewing as an MSL. If you're just reading off the slides, oh, then definitely out. This candidate is out.
What were the challenges you faced when, because a lot of us doctors, we've been trained clinically and only clinical stuff. And especially if you're clinically inclined doctors, if you're ever given any non-clinical job, like, doing the census and all that, you get so pissed off because it's more work. So without all this extra experience, when you transitioned into pharma, what were the challenges that you faced?
Oh, there were a lot of the challenges, but the number one challenge that really struck out for me was that because it's an MSL, you're not the sales rep, so you're not promoting the drug, you're not selling the drug. As an MSL, you're more of selling the science, selling the paper, the clinical value of the molecule and everything, but not the product itself. So but you have to work like a rep where you have to go out and meet the doctors, make appointment with the doctors. And not all doctors are very friendly with you, especially you coming from pharma. Even if they know that you're a medical doctor, but they see you as coming from pharma. And when you're coming from pharma, they just see you as like, oh, you're a sales rep. So that was a huge challenge for me, where they thought that I was also sales rep and everything, and they didn't know that I was like a medical doctor and everything and all that. And also having to wait on them, like, because some doctors, they won't respond to your texts or your emails or your calls, so you have to walk in their clinic and you have to wait outside, wait for them to finish seeing off all their patients before you get to go in and meet with them. Or sometimes, like, they don't even ask you to come inside your clinic, they just like leave the clinic and you have to like chase after them and talk to them at the corridor. So that was a huge challenge for me, because as a doctor, right, I'm thinking like, I'm also a doctor. Why am I having to chase you? So that was like a huge, that was something that I really had to overcome. But the thing that like made me like really overcome it was just reminding myself that if you don't do this, then after this, you just have to go back to GP because there's nothing else for you to do. So, so I'm just like, just go through with it. Just go through with it. What helped was because I was one of the first few medical doctors coming from KKM that was hired into Novartis as an MSL at that time. because most of the time at that time, a lot of the people from medical affairs were like pharmacists or have like biomedical background and stuff like that, but not medical doctors from KKM. But after I was hired, a few months after that, they started hiring other medical doctors from KKM also, who were also like the same, had also the same experience as I did. So that helped. So we had bonded a friendship and everything, and then so that helped. So knowing that I wasn't the only medical doctor going through this. So yeah. So but yeah, that was a huge challenge. And until now also I see some medical doctors coming into pharma as MSLs, and they have to leave within a few months because it was something that they couldn't overcome. For them, they didn't like the fact that they had to wait on other doctors like many hours in front of their clinics and everything. And also a lot of the doctors also that we see are quite judgmental as well. Like knowing after they know that, oh, you're a medical doctor, you came from KKM also and everything, but now you're in pharma. And so they always, I know that that's not their intention, but they will always ask you, why did you decide to go to the dark side? You know, you were on our side, now you're on that side. That was a bit hurtful also for them to ask that kind of question. Now I'm used to it. Now they don't ask me that anymore. But now because we see more and more medical doctors going to pharma, but back in 2016, you hardly see any medical doctors going to pharma. So that was tough at that time. So now it's much easier. Now the doctors, the specialists also, they know about pharma and they know about medical doctors going into pharma.
Yeah, that whatever you just said just rang a bell because I remember when I was in anesthesia, I was in the ICU, and I was in ICU in Sungai Buloh, and we have a lot of fancy equipments there in Sungai Buloh. And remember one medical, I can't remember whether he was a sales rep or a medical rep now, but he was a doctor. I don't know if it was he didn't quit, whether he quit after housemanship or he completed his training whatsoever. But it was a medical doctor. He brought the equipment and he was showing us how to use it. And I remember the moment he turned his back, and then it was, during all the CME, we only look forward to the food. So when it was time to take the food, we all rushed it. And you could see all of us, we just huddled together, and then we were bitching about him. It's like, oh my God, he went to the dark side. And then we're asking, how much do you think he's making there in this medical device company? What do you think is his commission? And then we were just talking about it. It's like, oh my God, this guy just betrayed us. And we were just going on and on about that.
Yeah. I think most medical doctors who have no exposure to pharma, that is their thinking, and definitely that would be my thinking as well if I had stayed in clinical. So I don't blame them, but it hurts a bit when they talk that way.
How do you respond to it when they said that to you?
Oh well, being an MSL, what we're trained to do is to have a very thick face. So even though they are insulting you, you just smile there and say, oh no, doctor, I'm just exploring pharma also and everything and all that. I'm not on the dark side, I'm not promoting the drug. I'm not like selling the drug to you, but I just want you to know what is the new data for this drug and everything and all that. So it just need to smile because yeah, you need to be thick faced no matter how bad or if the doctor is like really insulting you or scolding you or all that, you cannot take it personally. And that's why I tell like new MSLs also, like whatever happens to you out on the field, don't take it personally. It's not that they hate you, it's just that that's the nature of the job. You just don't take it personally, you just need to have a thick face, that's all. And anyways, behind them also, when we go back within our own peers and everything, we also bitch about them as well.
Do you think your medical degree or your clinical experience brought any weight into what you're doing right now?
Oh yes, definitely. So one of the things, the advantage of being a medical doctor in pharma also is because, especially if you have that clinical experience, that's very important because as a MSL or coming from like pharma side and everything, right? You also need to understand the doctor's perspective as well, especially those that are working in MOH and KKM. You need to understand how the system is like, how when they see patients and how they manage patients and everything. You need to have that understanding. For someone who's not a medical doctor and didn't go through all these clinical things and everything, they don't have that understanding. So for them, they would think that this is easy. This is something that they can just implement, isn't it? Like, why aren't they not like on our side, this will be helping in their practice and everything. It's not as easy and practical as that. And for those that have been in the clinical setting, they would know. Like for those, like for example, right now in AZ, we're trying to implement something in the medical wards for COPD patients. And for me, I know it's something that if I was the MO in the ward and AZ came to me and asked me to do this, I wouldn't even bother to do it because how how busy the wards are and how many patients you have. You think I have like 5 minutes of my time to do this? Whereas in AZ's perspective, we're like, it's only 5 minutes. You don't even have 5 minutes to do this simple job, and it actually will help you like in like the long term, it will help you. But as a doctor, as a MO in the ward, I'm like thinking like I would be thinking I'm not going to be in this ward long term. Like it's like every 4 months we will rotate and everything. So why would I care? So when you don't have that perspective, it's a bit harder to really have the doctors relate to you also. So as a medical doctor, when I introduced to them that, oh, I was from KKM last time, and then I would talk about my experience and everything, they find you more relatable and they will open up to you more. It's a bit more receptive. So definitely it is an advantage.
Sounds like it's easier for you to build that rapport because there's a common ground.
Yeah, definitely. Building that rapport is also much easier. But not to say that all medical doctors are better MSLs compared to those non-medical doctors. I have seen non-medical doctors as MSLs who are really, really good as well, and they can really progress in their career and everything over those that are medical doctors. Because I've seen medical doctors that are really actually really, really bad MSLs. So it really depends. But when you use that advantage in the right way, when you use your experience in the right way, then you can really progress far.
Okay, how do you think you are impacting healthcare differently in your role right now?
So I have to admit, initially, when I was at MSL, starting out as an MSL and Novartis, because again, I was like really new in that and everything, I didn't really feel that I was really impacting healthcare in any way compared to if I was actually a medical doctor and I was managing patients and saving patients' life and everything. But coming into pharma, if you don't have that direct contact with patients, you don't feel that you are really doing an impactful job. Even though that time my bosses and my managers were saying things like, oh, this project will impact healthcare in this way, will change practice in this way. It was like a very overarching type of vision that
Wow, sounds like, I mean, because like you said, right, during COVID was such a stressful time. When it initially the whole pandemic initially started, I also had that feeling of guilt because my colleagues were on the ground and I was in the lab and I wasn't sure what is it that I'm doing. But the moment when they managed to set up the lab and the whole setup, I think a lot of us also decided to just volunteer ourselves, and we worked 12-hour shift just so that we can do the testings and get the results quick. So yeah, I can see how, your I think it's the way we were trained to think when we were in medical school and in our medical training, that it's only if you are directly touching a patient, I'm doing something. But we don't think of all the back end work that is being done to support that. Okay, what's your advice for junior doctors who may be going through what you went through while you were in housemanship and emoship, being uncertain about themselves, their careers, and also those that want to get into pharma? I think it's not just for junior doctors, like what you're sharing. I think that applies for all doctors. Would you say, don't lose yourself? I think I was a very different person when I was practicing medicine as well. So what about for those that want to transition into pharma? Like what should their first step be? Okay, thanks, Nadira. So that wraps up another episode of Postcall Beyond the White Coat. Remember to check out our non-clinical Pathfinder workshop and our annual Disruptive Doctors Conference that happens every August, where like-minded doctors come together to share ideas and impact healthcare differently. Until next time, I'm Dr. Selina. Keep disrupting the norm.
Join disruptive doctors. Oh, oh, disruptive